now that we all in the industry are better understanding the whole ecosystem of health, and that's what we've been focused on in Kaiser Permanente. What you discover is a big difference when you look at the differences in communities in which they don't have grocery stores, in which there's high crime rates, which brings on stress and the inability to go out and play. And when you don't have the right infrastructure that is friendly to health habits and possibilities. And so what we are doing in Kaiser Permanente is actually working in public-private partnerships. We're working with the school systems. We are working within zip codes to facilitate getting better infrastructure. And now with the capabilities of technology, we're able to connect the dots to make sure that resources are being maximized to the full extent.
Gary, let's talk about that, because that was what you did at Aetna. You took a lot of the information you could find out about people that you digitally tracked and then tried to find ways to improve healthcare outcomes, because it means not only that you can save money at the insurance company, but you can give better outcomes, as Bernard just mentioned.
Right. Yeah, the point Bernard is making is critical. And really one of the tragedies in American healthcare is that so many people are more ill than they need to be. That is to say, they are suffering from some set of chronic conditions, but could be substantially healthier if they were able to manage those conditions consistent with the best medical counsel that's available to them. But because of perhaps where they live or the social circumstances under which they're cared for, they end up in a position where their health is far below what it might be. And that gap presents a tremendous opportunity, not only to improve health, but also the economic cost of a person suffering to that degree when they don't need to is very substantial. So if we can raise a person's health to something consistent with those who are in the best position with similar diagnostic circumstances, that convergence is a great clinical outcome and a great economic outcome.
A great economic outcome, not only for the companies like yours that are watching this on a margin all the time, but also for the country overall. We talk constantly about this issue because it's such a big part of what we spend as a nation and something that needs to be addressed. Are these things that you are learning on the company level that can be translated into a government level and really attack this?
Oh, absolutely. And actually, in some cases, in cities across the country, in the markets, for example, at Kaiser Permanente, we have the government very much engaged in this topic. I mean, the reality is, it's still the basics. What you eat, exercise, sleep, which is all part of rejuvenating the body, all part of good health. These are basic formulas that helps to produce better health. And the healthcare system is also going through a transformation. You know, Kaiser Permanente was built on prevention, early detection, early diagnosis. The healthcare industry is still a fix-me system.
Right.
So many in the healthcare industry are starting to understand the whole total health concept. And you know, and I think what we are doing now is moving much more into how do we invest in our communities in different ways that builds on the whole ecosystem of health. And being in schools is one of them. Dealing with issues about housing and shelter is another one. We do farmer markets around the country to bring fresh fruit and vegetables into the marketplace. We're teaching people how to eat healthy. It's those kind of things.
Can you tie that back directly to bottom line and say when we spend this much on prevention and on good diet and on helping people that it saves us this much down the road? Because I think that's what it would take before we make some massive investment.
A real important point I want to make here, for me, it's not about the bottom line. It's about keeping the money in the pockets of the American people. Because the issue is affordability.
And better outcomes, too.
And better outcomes.
But if you're going to expect government to get behind it, I think you probably have to say you're going to be saving yourselves money over the long run.
And that's how we win over the government. And Kaiser Permanente is a great example of it because we have an end-to-end responsibility for the health and well-being for the populations that we take care of. We have fantastic physicians as part of our Permanente medical groups, and they are experts in prevention and chronic care.
You don't want to bash the drug companies, I understand that, although they take some responsibility, I think, for this. We had Toby Cosgrove on last week. I think he was promoting adopting some of the policies of Europe in terms of that we should be re-importing some of these drugs. And he realizes that we subsidize the drug development for Europe, but still thinks that we ought to bring back the price-controlled drugs into this country to help people afford them more. Is that the answer? To me, it just seems like we're we're importing price controls, which would make us not develop drugs in the future? I mean, what's the answer there?
Well, I mean, I'm not here to bash, as you said,
Right.
because
bash them a little. I mean,
well, we all have to be in. I'm challenged also with drug pricing, but at the same time, we now are at a stage in healthcare where we're seeing drugs that can cure.
I mean,
so I don't want to throw out the baby with the bathwater.
That's the offset. It might be a lot cheaper to take an expensive drug than to sit in a hospital for.
But Joe, there's another element to this, which is unfortunately, oftentimes people are prescribed expensive drugs that really are not efficacious. And with the emergence of much more sophisticated mathematics and clinical diagnostics, we can pinpoint precisely what medicine.
What should we do about the way that it works over in Europe? Should we let them negotiate lower prices for their people over there, even though we put in all the R&D money for the development of the drugs?
Talk about taking the trade war to the.
I'm just not sure how we do it. They get a free lunch and much cheaper drugs. Should we just say, well, let's not fight them. If you can't beat them, join them. So bring back the price-controlled drugs here.
No, I would say we have to look at all options. But quite frankly, in my situation at Kaiser Permanente, I know what we're spending on drugs, and there's got to be a better way. But the other benefit.
But what is the better way? What is the real better way then?
Well, we do need to look at what does it take to put more transparency on the pricing of drugs. We also need to look at systems like Kaiser Permanente, and I've opened my doors, the doors of Kaiser Permanente, to your point, to look at how our physicians practice medicine, because they have tools and they are making great decisions about the best medication for the members that they take care of. So
Bernard,
it has to be a systems approach, not just distributing
We're out of
medication.
time, so I just one word answer on this. You've got 12 million, more than 12 million members. Is that scalable to 300 million? Could that go and be the entire country?
Variations of it, absolutely. No question the value system is scalable.